Hi, I'm Cheryl Hirsch. I'm one of the speech pathologists on the team, and I work with kids with feeding and swallowing disorders. One of the reasons that we think about aspiration as a contributor to maintaining their health and getting them home from the hospital as soon as possible is because aspiration is silent in nature. So the literature tells us that 80% of kids who aspirate, so when they drink, it slips into their airway, and they don't show signs of coughing or choking. So we have to look at the whole child and watch their pulmonary status and any gurgling, wet, congestive sounds. One of the things that predisposes children with feeding and swallowing disorders is prolonged intubation. These kids, because they have a lot of medical negative attention to the oral cavity, they may have oral aversion. They may have reduced sensation because of the ET tube in their pharynx and their larynx, or they may have some insult to the vocal folds, predisposing them to coughing and choking. When a child is aspirating, we can do several things. The first thing we can do is change their position. If you are feeding a baby a bottle, and while you are feeding your baby, if you hear coughing and choking, if the baby sounds wet and congested, we think about using gravity as the most natural way to reduce aspiration. So here, if you look, this baby, the liquid is going from the bottle straight into the back of the baby's mouth into the pharynx. One of the easiest interventions is side lying. So the literature tells us that this easy intervention helps the baby. They're now in their natural breastfeeding position. The liquid in the bottle is now in a horizontal position. And so when we feed them, gravity is actually pulling the liquid to the bottom of the bottle and not to the back of the baby's throat. This way the baby has control to withdraw the liquid, and if they get too much liquid in their mouth, the liquid could end in their cheeks and not in the back of their throat, causing aspiration. One of the second interventions we can do when one of your patients is aspirating or has pulmonary distress from feeding is thicken the liquids. Our ratio for thickening is 50% liquid, so it's a 1-to-1 ratio. So 15 mLs of liquid and 15 mLs of Gerber baby food or any puree. So for a nectar-thick liquid, the Gerber is a 1-to-1 ratio with liquid, and we would have the family just open the bottle and pour the Gerber in and close it and just shake the bottle and then proceed to feed the baby in a safe manner. The second method we can use is we can use baby Gerber oatmeal cereal, and the recipe for that is 7.5 mLs to 30 mLs. So again, the family would fill the bottle with milk or formula, open it up, and add the rice cereal or the oatmeal cereal, shake up the bottle, and then proceed to feed the baby with the thickened liquid, and that reduces aspiration. If you have any questions, you can talk to your rehab therapist. There are physical therapists and dietitians and nutritionists and gastroenterologists who will be able to help and answer your questions.